money back in your Social Security. What is a Part B give back? I know you're seeing those ads on TV. I have seen too many of them. And people always say, is that a scam? I was like, it's scammy the way they're being advertised. A Medicare Part B give back is a benefit from a private Medicare Advantage company. It is not from the government, okay? It is not a stimulus. It is not the fourth stimulus. I've seen so many misleading ads all over the internet, and I apologize that you're seeing them too. But a Medicare Part B give back plan is a type of private Medicare Advantage that may or may not be available where you live. That's why I said it's kind of scammy the way they advertise it, because they advertise it nationally. Like if you want it, all you have to do is call them or sign up and you get it. That is not true. They are not available in every state. They're not available in every county. And therefore, you might not have access to them at all. When they say get back, whatever they say, $150 a month, $100 a month, $60 a month, depends on the plan that's available where you live. If you can get back $30 a month, or $50 or $100 or $150, whatever, up to the maximum of your Medicare Part B. So when I say, are they scammy? I'm always kind of like, I don't know how to answer this. They're advertised in a misrepresented way, but they're real benefits. They might be available where you live. It might be a good plan that covers your doctors and your medication and has the extra benefits you're looking for. And icing on the cake, it gives you money back monthly in your Social Security. So the number one caveat is you got to call us and let us research where do you live, what plans are available this year, because they change every year. There might have been a plan last year, but they don't have it this year. They're 1 year at a time benefits. So let us research it and see what plans available in your county have a Medicare Part B give back, and what's it attached to? How good is the plan that is attached to? Because it doesn't matter if they're giving you money back in your Part B if it's attached to a really bad health plan that doesn't cover your doctors or doesn't cover your drugs, right? The Part B, it should be the icing on the cake. We want you to make sure you get a good cake. So how does a Part B give back work? First of all, you have to be paying Medicare Part B. I guess that makes sense, right? If you're paying for your Medicare Part B, instead of paying for it, they're going to give you money back. Instead of taking money out of your Social Security for Part B, they're going to put it back in. Social Security and Medicare working together. So if you had a plan that had a $100 give back and your Medicare Part B will say is $150, then they would only take out $50 a month out of your Social Security for your Medicare Part B. Okay? Pretty simple. Now, you have to be paying Medicare Part B. So if you are on Medicaid and you're not paying for your Medicare Part B, you can't buy a plan that puts it back in there because you're not paying for your Medicare Part B. If you buy a plan and you're like, yes, this is so exciting. I bought this new plan. It's got my doctors. It covers my medication. It's got dental, whatever, all the exciting extras. And I'm going to get $100 extra a month. You might think your agent scammed you or the TV ads were misleading because that first month you didn't see an extra $100 in your check. It's going to take a little while for it to kick in. It could take up to 3 months before you'll see it kick in, and then you'll get that 3 months, and then every month it'll happen. The same thing if you change plans. So next year, if you decided this plan really cost me more, it had the Part B give back, but I had higher copays, I had higher deductibles, it didn't have X, Y, and Z, and I'd really like to move back over here. The same thing, it'll take Social Security about 3 months to stop doing it. To start and stop, it's always about 3 months. So that's something to be aware when you're dealing with a Medicare Part B give back. If you have questions, your number one question is going to be, how much can I get? And that's going to be dependent on where you live. And it's going to require a prolonged discussion so that you're not just buying the Part B give back at the expense of getting a plan that costs you more, that doesn't cover your drugs, that doesn't allow you to go to the hospital of your choice, that is not a good health plan for your needs. So we want to see if we can meet all your needs with a health plan And then if we can put some icing on that cake with a Part B Giveback, if one's available in your county, explain that to you and help you make that choice. I had a really nice chart. I'm not going to put it up here, but it was for one county in Ohio. Okay, so one county. And there were 36 plans available. 2 plans had a Giveback. One was $30, one was $60. Most of the plans did not have a Giveback. And for the client that I was explaining her options to her, I wouldn't even consider the 2 plans with the Giveback because they were inferior plans to the other plans that were available. They had higher out-of-pocket costs, higher co-pays, higher co-insurance. They were trying to lure the person that wasn't very savvy, that was just seeing a shiny penny. I'm like, oh, I want that. And that's not what we want for you. We want you to, I know it's confusing, but we want you to try to understand the options that are available where you live in your county. And like I said, they change every year, so you got to spend a little time with us. See what's available this year, what's going on with your health, your budget, your drugs, and we'll help you make that decision. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment. If you have a specific question, always feel free to call us or email us at the Medicare Family.